I really enjoyed teaching about my specialty. I feel very lucky to be in the field of plastic and reconstructive surgery, and I really want to pass on the truth as I see it, and that's pretty much the purpose of this evening, is to give an introduction to the other 5 seminars, to lay a foundation, and essentially talk about the truth as I see it, the truth about plastic surgery. I think, of course, there are a lot of misconceptions. There's a lot of hype. There's a lot of misunderstandings. But I think if we return to science, I think we can use science as a foundation to really move forward and really know the truth. And I want to emphasize realistic expectations, the pros and cons of whatever we do. Because that's important to me, and I know it's important to anyone who comes into my office, that we do whatever we can to bring satisfaction. So, as I said, tonight will serve as the foundation for the next 5 seminars. I'd like to tonight talk about the skin, go through the layers that we see structurally under the skin, talk something about, or talk for a little bit about Botox, about fillers, skin care. I know we have some estheticians here, so I'm not going to be able to teach them anything. They're the experts. But I will give an introduction to what skin care is all about, at least as I see it. And I will give an introduction to the way I evaluate someone and some concepts of beauty. So first of all, everyone wants to look their best. And that's not vanity, that's healthy. You know, if we see someone on the street that doesn't care about their appearance, then we recognize them as dysfunctional or ill. So it's not vanity. Everyone cares about their appearance. They want to look their best, and that's very healthy. However, as we grow older, people grapple with these issues, and now you can barely open up the newspaper or turn on the television without hearing all kinds of options and choices. From surgery, of course, I'm a plastic surgeon, to dermabrasion and microdermabrasion and new minimally invasive procedure and Botox and fillers and what are peels and what can I really get out of a facial and what are lasers, etc. So what I'd like to do is again, present some science regarding the truth as I see it, and we're going to lay the foundation for a lot of these procedures that are available. To start, every person that comes into the office, whether it's to see the esthetician, dermatologist, plastic surgeon, they deserve a custom-designed approach. That's because everyone presents with a different degree of sun damage, a different degree of aging. Some people will come into the office and they have not yet shown any signs of aging, but they want to show something, or they want to correct something. So I think that every person who comes in deserves a custom-designed approach. And the approach that we take will be based a lot on what they want and the analysis in the office. So everyone needs to be studied and interviewed very carefully. I think what people want is really of paramount importance, rather than what I think they should have. Okay, now everyone can recognize aging, but actually what happens when we age is not 100% clear. There's a lot of different things go on in the aging process, and everyone ages differently. What I'd like to do is start with some anatomy and talk about the layers of tissue that I see and how I evaluate a person that comes in. For example, if I were to look at their face or the neck. And this is going to serve as the foundation for a lot of what I talk about over the next 8 to 10 weeks. And the estheticians know this. First of all, the skin has 2 important layers in broad categorization, or in broad generality. There's the epidermis that we see. That's the top layer of skin that we see. And under that's the dermis. Now the dermis is actually so much more important to appearance and function and blood supply of the skin than the epidermis, but what we see is the epidermis. Underneath the dermis is the subcutaneous tissue. That's the fatty layer. And that's very consistent throughout the body. Right underneath the skin, there's a little bit of, or it can be a very thick layer of fat. Underneath the fat, sometimes within the fat, there's a layer of fascia. Fascia is like gristle. If you eat steak, I think you're going to know what gristle is. Gristle is sometimes it's so thick and tough, it's like leather. Actually, sometimes fascia can be very thin and almost paper-like. But within the fat, or just under the fat, there's a layer of fascia. Then comes the muscle. responsible for motion, of course. And under the muscle, on top of the bone, there's the periosteum. That's a Greek word for around the bone, periosteum. And then we get to the bone itself. So again, there's the skin, made up of two layers, the epidermis and the dermis. Under that's the fat. There's a layer of subcutaneous fat. Then there's fascia. Then there's muscle. And then we get to the bone. Now that's pretty consistent throughout the body. There's a few places in the body where that's not true. But for the purposes of tonight's discussion, those are the layers that are important. So, skin, fat, fascia, muscle, and bone. Okay, so as I said, everybody can recognize aging, but exactly what happens in the aging process is not completely understood. And actually, plastic surgeons and people who study faces can disagree. And the makeup artists in Hollywood oftentimes know how to make someone look older and know how to make someone look like they're aging. And they often have insights that many of us don't have. But for example, we can grade signs of aging as we look at the nasolabial folds on the sides of the mouth. Grade 1 is invisible. We can get to grade 3 when you start to see them. And we can get to grade 5 where they're very prominent and you have ridges or wrinkles around that. Now, each one of these people, when they come into my office, if they wanted to change their appearance, they would get something different. We can't treat everyone the same. And the same with the periorbital area or the glabella. Everyone recognizes signs of aging, but we don't always agree on what they are. People can develop furrows, parts of the brow descend, and actually parts of the brow actually elevate with age. It's interesting that if you study a person over years, the medial brow, or this part of the eyebrow near the nose, actually elevates with age. However, the lateral brow typically descends with age. So it's very interesting to study people over time, and not everyone ages the same. So again, this is a slide that we're going to emphasize again and again tonight. There's the skin, which is two layers, right? Epidermis and dermis. The fatty layer, the muscle, and the bone. And of course, there's fascia on top of the muscle or within the fat. Now, the skin, of course, is a very complicated structure. There's more than just the simple epidermis and dermis. Of course, there's the sweat gland, there's the sebaceous gland, there's the hair follicles, etc. What I think is important is the dermis, that part that we don't see, underneath the epidermis. That's where the business is. That's where the strength is. That's where the blood supply is. And if you want to look at different ethnic groups, much of the difference can be found in the thickness and type of dermis. For example, people in Scandinavia who hardly make scars. I can make an incision right across the cheek for a person from Norway, for example. And 6 months later, if they're properly sewn up, you can oftentimes barely find the scar. People from Africa have very thick dermis and oftentimes will keloid. So oftentimes it's related to the thickness of the dermis. But again, the epidermis is what we see, the dermis is underneath there, and that's really the business end. The very top layer of the epidermis really is not living, it's like hair. It can be scrubbed off, it can be microdermabrated off, as the estheticians know, different treatments we can carry out, and that can have different effects. The other point I want to make is the basal layer, or the stratum basale. That's the real factory to make new cells. And we can actually influence the rate that those cells turn. And something that's important to emphasize is a new baby cell takes a minimum of 30 days to get to the top before it's visible. So sometimes I'll see a patient and the esthetician or I will start them on some skincare, and after 2 weeks or a week or 3 weeks they might say, I don't see any difference. Well, it takes a minimum of 30 days for the baby cell, the new baby cell, to get to the top. And there are things that we can do to accelerate that. But I do want to emphasize that point. Again, the very top layer of skin is not really living, it's like hair. And the factory that makes cells is down deep, and it takes a minimum of 30 days for a baby cell to get to the top. Now again, the epidermis has different layers. The dermis is really the business end, and the very top layer of the epidermis is not living. Okay, now this is a cross-section of skin that has not been exposed to the sun, like hardly at all. And compare this to a cross-section of skin that does have sun damage. So the dermis is thinned. The collagen, which is the structural protein that gives the dermis its strength, is markedly thinned. It's in disarray as opposed to being very orderly and quite thick. With sun exposure, that very top layer, the corneal layer, can get thicker, but the dermis itself can get thinner, and the collagen is a very basic building block protein within the dermis. It can get very thin and disorderly. And there's other changes. People get sunspots or liver spots or aging spots. There can be increased pigmentation, as you know. And so really, I think our worst enemy, especially for those of us who love to go outdoors, is the sun. So if there's one thing that you can teach the youngsters, it's really to avoid that baking and laying in the sun. You know, we all, hopefully by now, know what that does. Now, so what about the so-called wrinkle, or line of expression, as I like to say to them? It's more of a line of expression. As that collagen gets thinner and goes into sort of a disarray pattern, with time and motion, that skin, dermis and epidermis, can lose its resilience, and hence it can make a fold. That's really what a wrinkle is. It's a fold in the skin. And you can have different types of wrinkles. There can be wrinkles with motion, and there can be wrinkles at rest. And we address those differently, and with different types of therapy. But most of our therapies to minimize the lines and minimize the wrinkles are aimed at the shoulders of the wrinkle, to lower them, and also to encourage the new cells to come up from underneath. Okay, so of course, whenever I talk about skincare, and I know there's estheticians in the audience, you know, I need to be very careful, and I'm a little self-conscious about that. But from my point of view, I want to tell you a little bit about the science of the essentials of skincare. If we're going to only do 5 things with skincare, number 1, we want to teach people to avoid the sun, right? Because it's documented, it's not magic, it's science that with sun exposure and UV light, the collagen is affected in the dermis, the epidermis, the keratin layer gets thicker, but the dermis gets thinner. The collagen gets into more of a disarray pattern. So if there's one thing that we can do to save our skin, it's avoid the sun. Number 2, the esthetician or your skincare specialist can teach you to properly cleanse. That can get a little complicated because some people have dry skin, some people have oily skin, some people have patches, etc. But to properly cleanse the skin is important. Number 3, what about exfoliation? That top layer that's not really living and can have hyperpigmentation, etc., we want to get that off slowly. If someone comes in and they tell me that they want to attend a wedding in a month and they want laser today and they've never done anything for themselves in terms of skincare, that's sort of a setup for a problem. Because I think the real way to treat someone's skin is slowly and gently and get the baby cells churning and to gently exfoliate while we teach people the other steps. Now, what about to restore? There are actual treatments and ways that we can increase the collagen in the dermis, not only increase its thickness and the depth, but to increase it and make it more orderly. And there are actually things that we can do to accomplish that. And many of the estheticians are experts in that. I'll go through some of those in specific, but there are ways that we can get that factory in the stratum basale, or the basal layer, to actually churn more cells and get more baby cells going and then move to the top. Number 5, moisturize. That's very important. Many of us, if we scrub our skin, especially the face, and we don't moisturize, immediately it looks older, it looks more weather-worn than it is, just because it gets dried out. So, again, in summary, from a scientific point of view, the 5 essentials are avoid the sun, properly cleanse, exfoliate, restore, and moisturize. And I'm going to go through some specific steps, and there's all kinds of treatments over the counter. There's all kinds of treatments that you can buy, and people trying to sell to you, etc. But I think keeping the science in mind of really how to take care of your skin is essential. And I think that anybody who's been exposed to the sun, which is anybody who likes the outdoors, really can benefit from skincare. It's like dental care. I mean, it's like getting your teeth cleaned, etc. I think it's good for the skin. And there's also good evidence that proper exfoliation and proper skincare can actually lead to fewer skin cancers. And I think that's a side benefit. Okay, so again, this is a take-home message. The epidermis is on top, the dermis is underneath. Collagen is the protein. That's the basic building block in the dermis. It's a protein. Now, how can we get that factory churning? Retinoic acids actually help. They can actually improve the turnover of those cells and increase collagen. Retinoic acids, retin A, derivatives of vitamin A, not only can they get the factory churning, but there's good studies that indicate people can have less skin cancers with that. Vitamin C, the ascorbic acids, can actually exfoliate and stimulate those cells. The CO2 laser actually has been demonstrated to result in more collagen being laid down in that dermal layer. Some fillers can actually do that. It may be a physical effect of the filler going in and expanding and just creating a little pressure in the dermis, which the body reacts and lays down collagen. But certainly there are actually things that we can do to increase the collagen layer, not only the volume, but the orderliness of it. Okay, just for example, ascorbic acid, vitamin C, stimulates collagen synthesis, inhibits elastin that can be harmful. It can affect the pigments that we know, improves the epidermal barrier function, etc. And it can produce some anti-inflammatory effects. So I just picked this one slide out of a good text that I like, that actually we do have scientific evidence that there are some things that can help churn that collagen factory and turn it on higher. Okay, now here's an example of some sun-damaged skin, and with proper care and treatments, we can see that the dermal layer gets thicker and those cells can actually kind of get to work and there's increased collagen. So it's documented. Okay, now, I just want to talk briefly why this stuff gets a little bit complicated is because everybody has different types of skin. Not only are there people with oily skin and dry skin and patchy skin, etc., but we need to classify people according to the pigment in their skin and the way they react to UV light and sunlight. The most commonly used classification is called Fitzpatrick. I don't think it's necessary that this is memorized, but just keep in mind that type 6 are dark Africans, type 1 are almost albino people. You just go out in the sun for the first time and your skin gets so red and you hardly ever tan. And 1, 2, 3, 4, 5, that's gradients of that. So people actually need to be classified before they're going to get something like a CO2 laser or a peel, etc. Because that can predict, actually it can guide the therapy. So it can get fairly complicated, but using these classification systems, it's reliable. But I think that it's good to go to someone who's experienced. Just in summary, here's a skin type 1, the color is white, always burns, never tans. I'll go through these quickly. Usually burns, tans with difficulty. Fitzpatrick 3 sometimes exhibits a mild burn, but they get an average tan. And then rarely burns, but tans with ease. That's people with moderately brown skin. And then, of course, skin type 5, dark brown. Very rarely burns, but tans very easily. And then, of course, never burns. Some people you meet that never had a burn in their life, and they tan very easily. Okay, so that's an introduction to the care of the skin. So I'm a big believer in skin care, medically supervised skin care. There are ways that we can get that collagen factory churning. That works. However, It's not the cure for everything. Now, I like to tell people that if I try to operate away wrinkles, that's just wasted time, etc. We don't really operate away wrinkles. But by the same token, to expect skincare to say correct big bags under the eyelid, or to take up lax skin, or to reduce folds of skin, that it's just not going to happen. So I think that, and I want to show you some examples. So for example, in the eyelid, certainly we have, as we said before, we have the epidermis and the dermis. We have a very, very thin layer of fat on top of the muscle. But really what's going on with bags is that the septum, a membrane that holds back the periorbital fat, is getting weak. In other words, around everybody's eyeball, around everybody's globe, there's fat that cushions and lubricates the globe. And for some reason, in some families, that membrane or septum gets weak, and that allows the fat to almost protrude through. It just pushes up against that membrane. So, again, we can classify, or we can follow the signs of aging. And not only does that septum get lax in some families, but with time, the muscle can lose some tone, and the supporting ligament, especially the lateral canthus, can get lax. And so it's more than just a sun problem. It's more than just solar aging. So, as an example, here's a gal that is basically good looking, but she has some redundant skin. She has some protruding fat. But if you look at her skin overall, she has very little sign of sun damage. But by strengthening that septum and pushing back some of the fat and taking some of it out and removing some of the extra skin, I think she can get a much more youthful, vibrant, living appearance.
Is that the same person as we just saw? Is that the same person? Really? That's the same person?
Same person. So that's a before and after. So I think the key here is, as I said, everybody gets a custom designed approach, right? Not everybody who walks into the office has severe skin damage. Not everybody has big bags under their eyes. Not everybody has a turkey neck, etc. So we have to customize our approach so everybody gets the maximum benefit. Now, here's someone who's a little bit on the other end of the spectrum. She also has bags under her eyes, but she also has some sun damage, right? She's got some extra skin and some folds. So she had a little bit of a different approach. You see, to take care of the prominent pouches of her eyes. So with time, not only can the skin be affected by the sun, but the supporting ligaments can be affected, and that protruding fat, or I should say the fat that's behind the septum, can almost want to push through. So everybody, I'm showing these cases because everybody deserves a custom designed approach. Right?
What did she have done? Can you go back one? Yeah.
Yeah, she had blepharoplasty, which is eyelid tucks.
Upper and lower?
Yes, upper and lower, and jowl and neckline. So the other principle that I want to return to is lots of younger patients are interested in looking their best, and that's okay. Lots of more mature patients are interested in looking like they did in years previous. Everybody gets a different approach. Typically, we try to avoid long incisions, which leaves longer scars in the younger person. And for the older person, what I try to do in my office is to have them leave with a natural look rather than a pulled or stretched look. And when I start to talk about fillers and fat, I'm going to return to that concept. So again, she still looks like the same person, right? But most people would think she looks fresher, more vibrant, more alive, etc. But we strive for the natural look. And inside view, of course, if you look at the neck and jowls, there's an improved contour. So, thanks for your question. unless I tell you, everybody I show tonight's an actual patient, my patient. So, and there will be, when I talk about concepts of beauty, you're going to recognize some of these people, and they're not my patients. And as far as I know, they've never had plastic surgery. Okay, so once again, not only can the skin be affected, that membrane that holds the fat in place can get weak, and the supporting ligament, commonly called the lateral canthus, can get lax, and we need to support that. So it's more than just removing skin, or more than just doing skincare. Hi.
Is there anything one can do to help maintain the strength of that membrane that you're speaking of?
The lateral
talking
canthus.
about repairing it, but helping reduce the loss of strength.
Yeah, I think that's a great question. I think to keep the internal ligaments of the body strong, I think exercise can help. I think normal weight can help. Some people think antioxidants can help. Well, but specifically to prevent the lateral canthal tendon from becoming lax, I don't know of any. I don't know of anything. Sure. Hi.
Mine's about the same question, coming around the eye area. Do you know if electronic muscle stimulation helps to lift those muscles back up? Or if that really is not really worthwhile?
The question, as I believe, is that can electronic muscle stimulation help? Mm-hmm. I think that muscle stimulation can strengthen muscles. It can't repair skin. It can't strengthen or shorten that lax tendon. And it can't push the fat back.
Do you think it could lift a lazy brow by tightening the muscle? Or would that be just not worthwhile even?
I was doing that for a while, using the muscle stimulator people, and we took a picture before and after, and it really works, but it just lasts like 3 weeks.
It lasts how long?
3 months.
Is that without another treatment?
No, you have to keep doing it and do it, and they usually come before they want to go to a wedding.
Okay.
6 weeks. It works, but it's not for all.
Yeah, there are some things that work temporarily, like some of the lip plumpers. I think is great for sort of creating a little sting and creating a little edema. And some people can get an improved look just by kind of making their skin a little bit red. It gets a little bit swollen, fills up some of the wrinkles. Okay, so I said that all over the body that those layers are pretty conspicuous. Skin, epidermis and dermis, right? The fatty layer, then there's fascia, then there's muscle. Well, we can look at those, and we can look at that tissue layer by layer. Now, as I said, that below the skin, we've talked a lot about skin and a little bit about eyelids. That fatty layer can be addressed. And I think, Christine, what are we talking about next seminar? Liposuction and body contouring? Is that who's got a program?
Yeah, that's what it is.
Okay, so we're gonna talk at length next time, but I want to show you an example of just by affecting the fatty layer, the effect it can bring. But here's something that's key in the right patient. Now, in the young patient, if they have skin resilience, that skin can just retract and get closer to the muscle. And that's what we're trying to do in simple liposuction, is get that skin to go closer to the muscle underneath it. But again, see this woman I'm about to show you, now that's her after. Okay, so we go from there to there. Now this is an actual case of mine, actual patient, I need touch photos. But you notice that I'm not showing you someone with a lot of skin damage or a lot of lax tissue in their neck. And you know, I titled this talk "The Truth About Plastic Surgery." If anybody thinks that heat treatments or internal lasers or these things that say that they melt the fat, it actually does melt fat. But if anybody thinks you get significant skin tightening with those devices, I'd like you to get 10 consecutive cases, bring me the photographs, and let's see them. And then I'll convert. I can show you photograph after photograph after photograph of people with skin resilience whose skin redraped and came closer to the muscle. But we can't have a realistic expectation that someone with lots of loose skin or sun damage can get that kind of result. So again, Remember I said every patient, every client deserves a custom designed approach? It's so true for liposuction. And that's one of the things we're going to talk about next week. Okay, so we talked about the skin. We talked a little bit about the eyelid and the septum. Let's talk a little bit about the muscle. The face is a social tool, as you know. Expressions communicate feelings, and that's vital. So, what's all the buzz about Botox and Dysport and all these things? I want to tell you the truth about these treatments. Botox is a brand name for botulinum type A. It's a muscle relaxer. It comes from a bacteria discovered in the late 1800s. I first injected Botox in about 1988. So it's been around a long time, but it's been used for cosmetic purposes only for the past few years or something like that. I don't know, 5-10 years. So it's a muscle relaxer. That's what Botox does. It's not a panacea, but what it is relax the muscles. Okay, so remember before I said there's wrinkles of motion and wrinkles at rest, lines of motion, lines at rest. So what Botox is great for, is if someone is in repose or rest, and they want to say minimize the smile lines, or at rest or in repose, they have no lines in the glabella. The glabella is this area right here in between the eyebrows. But with motion or with expression, they get lines. Botox is great for that. It really works. It's safe and effective, and it works, and it's outpatient. Now, what about lines at rest? Botox can help with that, but it can't make those lines disappear. Now, what I mean by lines at rest is even when you're in repose, or when you're not making an expression, if you have a line or wrinkle, the way Botox helps is by weakening that muscle underneath and making it relax. It allows it to soften, and with time, and hopefully other skincare, and sometimes fillers, which I will address, it can minimize the line.
Approximately how long does that last when you use Botox? Is it different for everyone's skin type? Or?
No, I think Botox lasts in general between 3 and 6 months. There's no effect for 72 hours or 48 hours. The maximum effect is at about 2 weeks. With repeated treatments, that muscle really atrophies and softens, and you need it less often and in a lower volume or less units. Okay, so this comes out of their catalog. It's pretty straightforward for around the eye. I like it there. I'm reluctant to do a lot of Botox work. In my practice, I'm reluctant to do Botox work like below the nose. I'll do micro amounts to the lip. I can do micro amounts to the chin. Some people get those furrow lines. You know, part of it's an aesthetic approach. I don't like to dramatically modify people's smiles. I don't like to dramatically modify the way people move their lips. I know some people are willing to do that, to minimize lines around the lips, but it's kind of an aesthetic approach that I'm not a big fan of that. Okay, so one of the other things that happens, okay, so that's an introduction to Botox. And Dysport actually is very similar. It's actually the same chemical but attached to a different carrier. Now, another thing that happens with aging is that we have atrophy of tissues. The fatty layer in some parts of our body will get bigger. In some parts of our body, the fatty layer actually gets smaller. The fat pocket. So, that's a great introduction to fillers. Fillers and fat. So, what are fillers? Remember how we talked about there's lines at rest and lines with motion? When we have lines at rest, fillers are really helpful for that. And there's tons of fillers on the market. There's some basic groups. There's hyaluronic acids like Juvederm, Restylane. Radiesse is another one that's kind of calcium-based. Evolence is a new one by J&J. Sculptra is has some very helpful functions, and it's very useful for people with lipoatrophy of the face. So there's all kinds of different fillers, and they're placed in different parts of the layers of the soft tissue. Some go right in the deep dermis, some in the dermis, some actually go right on the bone. So, as I said, fills lines. I like it. Filling lines is actually my least favorite thing to do with fillers, but I like it to plump up tissue. I like it to make a fuller lip, as long as we don't overdo it. And I like it to do non-surgical facial sculpting for people who might want a little more prominent chin and they don't want a chin advancement or implant. I like it to recreate the arch, what I call the arch of beauty. This line sort of, this is what I call the arch of beauty. Not me, but in good-looking people. And I think that most models have a very prominent cheekbone, and the lateral orbit is very prominent, so I think fillers are great for that. And it helps in the nasolabial folds. I think it can make them less pronounced. Now, this is not my case. As I said, every case I show you is mine unless I tell you otherwise. This came out of New Beauty magazine, the so-called liquid facelift, combination of fillers and Botox. I think you can get dramatic results. It takes quite a bit of product, Botox and fillers. It can get expensive, but I think it actually can help. I mean, it actually does bring results. Now, speaking of the muscles, as I said, everybody gets accustomed. Hi.
Just have a question. Do you have a preference for certain fillers, and do you include fat grafts at all?
Thank you for your question. I did about 2 hours of fat grafting today. So in certain areas, fat grafting is great. I think if you need a large volume, fat's great. If I needed 100 cc's of Juvederm, that would break the bank. I think fat's great for a person who wants their own tissue, who's willing to have, it's a procedure, it's an operation of sorts. We've got to harvest it and purify it and cleanse it and then re-inject it. It works. I think it's also good for the nasolabial folds and to make cheekbones. Most of my patients like that, so I like fat. And your second question, so fillers. I use some of the calcium-based products. I use some of the hyaluronic-based products. They have pros and cons. The good thing about hyaluronic acid fillers, is they can be reversed if needed. The calcium-based products cannot. So there's pros and cons.
Not only like school drugs, calcium-based.
Right. Okay, that's a great question. Thanks for asking.
Just on the fat
Yes.
transfer.
Yes.
Does that ever turn to fat necrosis, or will it stay in place?
Great question.
Does it get reabsorbed? Or?
Great question. With techniques of micro sculpting and fat grafting, when we lay the fat in little tubules or droplets, it's much more likely to survive, and it does survive. What some people have tried, like you take a big syringe and do liposuction, and then you take that one big syringe and just kind of like push it in, that has a low level of survival. Some of the fat that we re-inject doesn't survive. It's possible to get calcified. I think with structural fat grafting, the newer techniques, it really works. And some of the guys that have been doing it for 20 plus years, I saw some slides a few months ago at a meeting where people had fat grafting to the face, and 20 years later they had put on a lot of weight, and you could see like the fat almost globulous. So it lives and grows and survives.
So it would last longer than a filler.
Or it's your own tissue, so when it survives, it's there forever.
Thank you.
Sure. Okay, so what else about the muscle? As I said, I showed before the relatively young gal who had liposuction only, and she had great skin resilience and her skin retracted. Okay, so what about the person, and I'm going to pick up the pace here because I don't want you all to get bored or antsy. So, natural neck lift, sometimes the platysma muscle gets so lax and there's so much skin there that we have to address that. And liposuction just won't work. It just doesn't make the muscle tighten or redrape, and it doesn't make lax skin redrape. So here's one example of a woman who just wanted her neck to change. She didn't want anything above the jawline. So she had a platysmoplasty, which I tightened up the platysma that I just showed, that muscle. Anybody ride horses here? You know what the platysma does in a horse? The platysma is the shivering muscle in a horse. The platysma in our species, Homo sapiens, is a vestigial muscle. That means it doesn't have any function except to give plastic surgeons work. It starts here at the mandible, and it goes down the neck, and it stops at the clavicles. In the horse, it starts, the horse has that huge mandible. It starts the mandible and goes halfway or 3/4 of the way down the body, and it allows the horse to shiver and kind of get the flies out. So that's the platysma. That's in college, pre-med, one of my favorite courses was comparative anatomy. Anyway, I think it's just fascinating. Okay, so that's a platysmoplasty, direct lipectomy, and a neck lift.
So that's called a neck lift. You call that a neck lift and a lower face lift.
It's a neck lift, natural neck lift. Everybody gets a different natural neck lift, depending on what they present with. They could get only liposuction. They could get platysmoplasty, which is when I tighten the platysma muscle. They might get a chin advancement. Everybody gets a different approach. I'll talk a little bit more about that. So that's the platysma muscle right there. That's that big sheet. Okay, so you just asked a great question. Here's another young person. He's a man, obviously, who wanted a stronger neck and jawline, and what he called his chin line. It's really the jaw and neck. Now, he got a combination of liposuction, lipectomy, and chin advancement. So that's an actual patient, unretouched photo, but what I'm trying to get across to you is, the take-home lesson is, if you go home with one thing, it's that every patient deserves a custom-designed approach, right? You've got to, and careful preoperative analysis about what he or she wants, what they bring to the table, and where they want to go, right? And what they can sort of tolerate. And I don't like to use the word withstand, but I mean, if they say, I just want something in the office, they're going to get something. If they say, yeah, I can take a general anesthetic. Okay? Yes?
Quick question. You see on TV these guys that are advertising the miracle lift.
Yeah.
Lifestyle.
Or the lifestyle lift. And
Yeah.
then people are going to their doctor saying, I want the lifestyle lift. What are they doing?
Yeah. The lifestyle lift, to the best of my knowledge, it is a short incision mini cheek lift or face lift. To the best of my knowledge, they're sort of teaching it to non-plastic surgeons who want to get into the field. It can help. It certainly. I mean, it does excise skin. I do mini cheek lifts. I do mini cheek lifts in the office. I mean, I don't have like a fancy, name for it, but that's what I do. It's a mini lift. It's for people who want something that might last a couple years, or they've got a huge wedding to go to, or a photography session in a few months, and they kind of want a quick pick-me-up. So that's a lift. Sure. Yeah. Thanks for your question.
There's no scars. Are they hidden, or just has it been that long? I mean,
there's one scar inside the mouth, and there's one scar underneath each earlobe that we've hidden, and then there's what I call a worm's eye scar, one just under there. About 85% of us at one time or another fell when we were kids, or fell from a bicycle, and so we get rid of them. So, but again, the point I'm trying to emphasize to you is that, and I'm so glad that there's some people here from other beauty fields and the beauty industry, is that everybody deserves a custom design approach. If I try to operate away wrinkles, it's just a waste of time. And conversely, if people have real lax tissue and lax muscle and lax platysma, etc., to think that skincare or some like skin laser is going to take care of that, I think mostly leads to disappointment. Before I go on, I want to say one thing. We've got to kind of pick up the pace. I think skin lasers, etc., are great at resurfacing. They're great for texture. They're great for couperose, like the redness. They're great for so-called aging spots and sunspots. They're great to improve the texture. They're great for fine lines. But they're not great to correct loose skin. They can do micro amounts of tightening, say for the lower lid. I think they're great for that. But to expect the sort of lasers to take up the loose skin of the neck, it just, I think, leads to a lot of disappointment. Okay, so choosing the option, the needle or the knife. I just want to show you a few examples before I get to concepts of beauty. Okay, so here's a younger woman that I think has a great facial structure, still reasonably attractive. You know, the so-called makeover can be done in the younger patient with conservative, small incisions, minimally invasive incisions, with the proper skin care, estheticians work, a little bit of filler, I think can really give good results.
Excuse me,
Yes?
what did you do to her? Because she really looks amazing.
Well, I'm glad you think so. I did a minimal incision lateral brow lift through the hair. And I did upper blepharoplasty, and then I sort of snuck down with the scope to tug on her mid-face a little bit. And then she had a little bit of plumping and the right kind of skincare.
Can we see her before one more time?
Yes. Oh, and Angie's here. And I'm sorry, who's sitting next to you, Angie? Tiffany. You know, let's live a little, right? Like the right hair color and makeup, etc. Right? Like, let's live a little. Okay, now, again, does anybody remember the take-home point? Everybody deserves a custom design approach. If I tried to affect this woman's neck and skin with minimal incisions, I think that's going to be disappointing, right? And what I want in my practice, I want happy, satisfied patients, because I want to be someone's surgeon for their lifetime, and I want them to send their kids to me and their neighbors, etc. So this woman had a real incision. She had a real, like a longer incision to get to her neck, and then skin care, etc. So totally different approach. But I think, again, in terms of getting the maximum result for a patient, someone who wants to improve their appearance, careful preoperative analysis, right? Gearing what we do toward what they bring to the table and where they want to go. Okay, we've got to wrap this up. What about the hair? See, I thought there were going to be some reps here tonight, but they're bringing us goodies. Everybody know what Latisse is?
Yeah.
It's a real enzyme that helps lashes get thicker and longer, and I think it works. Okay, now, one of my favorite things to talk about, concepts of beauty, and I'm going to pick up the pace.
Quick question on Latisse. Do you see much eye color change, or that doesn't really happen where the eye can turn the iris, or the iris can turn brown?
I think that happens when people with glaucoma actually put it in their eye. I think properly applied, to the skin of the eyelid and the eye, the base of the eyelash. I think it's, I don't know, unheard of, or it just doesn't happen. But people have to know that. Oh, thanks for bringing that up. What's the downside to Botox? The downside to Botox, 4% nationwide of people who get Botox in the periorbital area get a lazy eye. Okay, but that's, okay, perfect. You should know it's temporary. There's things we can do to correct it. And my excellent staff know that a different muscle opens the lid as closes the lid. A different muscle depresses the brow as elevates the brow. So if some of that Botox can leak towards the muscle that lifts the lid, they can get a lazy eye. But we can treat that. But I tell even though my patients are very lucky and I know where to inject, etc., I tell all people, 4% of people nationwide can get that temporary droopy eyelid. But we can fix that. I mean, we can. Okay, concepts of beauty. Everybody knows a beautiful person when they see one, whether it's a man or a woman, whatever their race is. I love how that light. Remember I talked about the arch of beauty? I love how the light catches there. I love a strong jawline, big eyes. No matter what your race, concepts of beauty seem ubiquitous. Men, women, the strong jawline. See how the light's catching that cheekbone area. However, perfect symmetry is not always incredibly attractive. Lauren Hutton, remember her? She has orbital dystopia. Her eyelids are at a little different level. And you know, she has that little diastasis between her. So sometimes a little quirky look and a little asymmetry actually creates interest and creates attraction. However, you know, when you see so it's not always clear why someone is good looking, but when you see someone, you recognize it. But also when you see somebody that's not, it's also obvious. However, there's something called a divine proportion, and the ratio is called phi, 1 to 1.618. It appears that a lot of what we think is attractive and beautiful, we're almost hardwired for. And the Greeks and Romans discovered this, and great artists throughout history have discovered this. And those ratios are reflected in attractive people. And I'm going to show you some other photographs that goes beyond people. There are certain ratios that attractive people have in common. And it's related to that phi, 1 to 1.618. Now, and you can take an attractive face, and you can actually make some of these angles and make a mask, and that kind of mask, racial mask, will fit for men, women, no matter what their ethnic heritage is, etc. And again, it's really not just the size of the nose, etc., or the size of the eyes, it's the ratio and proportion of the facial. And the people who built the pyramids understood that, it's ratios. And these ratios, phi, is reflected in all parts of the body that's attractive. And it's also related to, anybody know what the Fibonacci series is, Leonardo Fibonacci? That's the series of numbers where if you add up the first two numbers, it equals the third. And then you add up the next two numbers, and it equals the next. Like 1 plus 1 is 2. And then 1 plus 2 is 3. And then 2 plus 3 is 5, etc., etc., etc. And that describes the shape of the nautilus. As you get further and further in the Fibonacci series, it gets closer and closer to that ratio phi, 1 to 1.618. So it seems like we're almost hardwired to recognize that ratio. You know, like a piece of paper, why is paper 8.5 by 11? It's very close to that ratio. Most attractive paintings that you put up on the wall, they're not square, it's a rectangle. And that rectangle has a ratio 1 to 1.618. The Parthenon, the Greeks and Romans, even if they didn't know the numbers, they understood those proportions were beautiful and attractive. And if you analyze the width and length of the Parthenon, etc., it's 5. It's 1 to 1.618. Good-looking cars have that same design. Unattractive cars don't. Violins, you know, I mean, to create those harmonics, the ratio of the violin body is 1 to 1.618. It's just almost, and the Milky Way reflects that Fibonacci pattern, you know, the nautilus that I showed. So it seems like we're almost hardwired for that ratio, 1 to 1.618. And so in my practice, what I try to do is look at ratios and proportions and work with someone to get harmony and symmetry and balance, and not just to have them look pulled or stretched or unnatural. Because I think ratios and proportions are much more important than that. And I'm very grateful that you came tonight. Thank you so much.